Well, good morning. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk some more about impacted teeth, regardless of which tooth it is in the mouth. Frequently we get cuspids impacted, and you can have molars and bicuspids and all kind of impactions. And back when I was in dental school, they allowed us to take out these impacted teeth, certain ones, and we were able to practice that. And I was thinking of working in the mission field, and I would have to do that. So I did all my impactions. And we were in a small town. There wasn't any orthodontist, or there was certainly no oral surgeon in Hurst, Euless, Bedford, and Colleyville, the whole area right there. So we did the impactions for that. So let me get into this picture just as soon as we can here, and I'm going to touch this thing. Now this young man looks pretty rough here, but is just a really nice guy. I mean, I enjoyed working on him. And this was back in the 70s, the early 70s, and he had a terribly impacted situation here that we worked with. And you can see the facial structure doesn't show it up all that much. But when you get to the models, you'll see it, and we have some x-rays on down the line that'll show a lot of this problem. But had a kind of a class 2 division 2 up here. There's a whole lot of things wrong in here. And so we're going to start out and kind of show what we did here to correct this problem for him. And this is both sides of the mouth. This is kind of a class 2 situation with class 2 division 2 anterior teeth leaning back. So we had it was the actual shape of the jaw is kind of an arrowhead. And so we're going to have to round this thing out, you see, and get space in there. And if you will check when we finish this cases up, how the shape of the arch is, what it would be like. Let's go ahead now and see down on the bottom we have the same problem. It's kind of a narrow, it's not as pointed down here. You don't see this central here doesn't show up. And so we're coming in from that direction. I'm going to try to go through this fast so you won't have to sit there and listen to too much of this. Well, to start off with, we had to open space up in certain areas, and we eliminated certain teeth and everything. And you've got an arch wire here that had a loop that we backed that up, and then we put a closed coil spring, an open coil spring in here to open this space between this and to bring the tooth in there. And that's going to tend to bring the midline back over to the center. See, this is the bottom. I think we got an impacted tooth there too. And you open it on both sides like that. Somewhere on here, this was 1984. It's later than I thought in here. And so we're opening those spaces for the tooth to come in. Now, I talked to you about how we bonded teeth on there. We put a hook on the tooth. And on the x-ray, you can look at different x-rays like you had, you could locate where the tooth was. And what we want to do is put the hook as close to the tip of the tooth as we possibly could get it, and then open the space here for the tooth to come through. And this was before we developed the really a super way to bring them in. right here. Now we're going to try to direct it into that point right there. Now, I don't expect people that haven't done any impactions to do this, but we learned to go and take electrosurge and just go around. When you found the tooth, we would go back and cut the tissue with electrosurge. Don't cut through to where it's like here. Just leave some of the tissue like that. Don't cut it. I mean, if you take this out, it's hard to get that back. So you stay away from the tip of it and just cut a place. And it cauterizes the tissue and it stops the bleeding. And you can go down in there and etch the tooth of this, etch the tooth. And now we would take a hook, make the hook where it comes up to the surface and where we can hook onto it. And then you put some bonding material in there and push that into it and let it harden in that area. And if it's, I mean, this is really good bonding material too. So we'll do that. Now, down on this side, have the same, this tooth here is extremely crowded out. And you see we got a little flexible wire coming around here. We'll enlarge this as we go. Now here this is straightened out. We've got the 4 anterior teeth lined up at the midline. It's all way the heck over here. So we'll have to work with that, and we get most of it lined back up here. Now, we got the tooth going, and of course, we came out here with some elastic thread we tie here. Now we come in and make a loop on this, or the way we do nowadays, and we come in and we run dental floss in there, hook onto that and come back out, and then tie it and pull the spring up here. We use a spring rather than try to use this little deal like that. So it took several years before we got that perfected. Now here we're pulling it in with an elastic chain, and the chain fatigues out pretty fast. So that's not the best thing to use in there. So we now use the springs, and they last the whole time in between appointments. And we in fact do the whole thing out there. Now you remember how crowded this was. We're enlarging this thing down here, and we've got the center. These are 2 centrals and the laterals, and the cuspids, and the first and second bicuspid, and on that side right there. Now let's get on to, we've lined it up and we've opened up a space here. And the equipment we have now, like these little brackets with wings that help you rotate the tooth if you like to use those, or you can just use just a single bracket like that. But here in between we've had the twin brackets, and we're opening a gap right here for a tooth to drop in that area. All right, here is the tooth we hooked onto, and we're pulling it right into this spot right there. And now we've got a tori up here in the roof of this. It looks like over on this side too. We have to deal with that. And then we learned I have taken the tori out on some cases, or send them to an oral surgeon and get it removed. Now this bottom is lined up pretty good, and maybe you can get each step we go in here to bring this about to enlarge that. And you see the little spring loop in this right here, and you push that in, it squeezes this so the whole arch wire is kind of enlarging the arch, and then you put your space spring in this area to bring that down. All right, we got it down good. Pull those teeth into place and close the space back up. And so here we are just about to get this finished up. We're using an elastic across here, trying to pull this upper in this direction and this in the other direction, and we will coordinate the arches back in the back. So this is 1985, and we still have this palatal problem, which I don't think we ever did correct that. Now right here we put a step down arch. We're making a space for this cuspid to come in. And there's where we have this step down arch. And then here we gotta make space in here. And you can put tip and move these roots away from that to bring it up there. Now there we've got the cuspid in. Let's we get to these x-rays here before long. Excuse me, we didn't get the cuspid in. We made a little plastic tooth and just bonded. We just took a denture tooth, it's plastic, bonded a bracket on it, stuck it in that area, and the thing looks almost exactly. You put a little torque on it, and you can't even tell it's not a permanent tooth in there. All right, here we go. Back doing this. The x-rays that we took was in 1983, right up here, and this is an old type Panorex. Now we had some impacted, wisdom teeth back here that we took out. I think it may have been one up in this area. We took them out. And here was this cuspid that we wanted to get down into this gap right there. And that's a pretty tough thing back in to do. So there we changed sides over here. We've got the central and the lateral. And there, that cuspid there, we brought it in, got it in the space, but we're missing one over this tooth right there. So we lined this all up, and so we ended up putting a bridge in here. Now today's, we would have brought all these teeth forward and tried to use the wisdom tooth back here if we could to close that space where he's missing that tooth. So here is this gentleman, 1986. We have finished it up, and we have this artificial tooth in this area, so we send him in. I made it back then. I was doing orthodontics. Probably sent him somewhere and had the bridge made. Well, we put it on his retainer. Now he's got his retainer in place, and we put a bite plate on that. Now he'll have to use this for quite a while to get accustomed to that. Now the lower teeth are lined up real good. Everything stayed. And this is 1990. He's got a little bitty retainer that I don't really like those type of lower retainers, but he tried using those for a while. In the upper, we've got this is bridged in now, and this tooth got a little space in that area. And here is the gentleman after we finished up. Very nice young man. He's got a tremendous beard there back then, but he did a very good job, and was just an excellent patient. And that was back in the 80s, and I had learned to really develop the mechanics of removing the moving impactions in that we've shown you earlier. So thanks for watching, and I hope you'll sign up with our channels, and we'll pass on, and I won't say goodbye for the time being. We'll see you again later.